Hello class, it's Miss Moran again. So chapter 13 is going to wrap up the 3 chapters that we have to cover this week. And for our coding 2, which is Monday and Wednesdays. Chapter 13 in the step-by-step book covers the surgery guidelines and general surgery. And surgery section of the CPT is the largest CPT section. The format, the codes start with 1 and end with 6, and they're divided by subspecialty. For example, integumentary, there's a lot of notes and guidelines throughout the whole section of the surgery and CPT, and information is varied and extensive. It's something that we must read. So if there's a change in the text, in the CPT description, you will see that there is a little like revised text. It's like 2 triangles facing each other. That means that some of the wording has been changed in that particular code. So subsection notes apply to the entire subsection. So all the notes in the musculoskeletal subsection will apply to all the codes in that subsection. Like, for example, terms closed treatment, open treatment, and percutaneous skeletal fixation have been carefully chosen to accurately reflect current orthopedic procedural treatments. So all of this information applies to the whole subsection of musculoskeletal system. Subheadings in the notes, for example, vertical column is a subheading right over here, and the notes here. So subheading notes will apply to the entire subheading. Category notes will apply to the entire category. Here the category is grafts or implants. Subcategory notes apply to the entire subcategory. Additional helpful notes, the parenthetical information. It's just helpful information. It just says resection of palate or extensive resection of lesion for reconstruction of palate or extraoral tissue. See these codes instead. So it's important to pay attention when there's some notes in our CPT manual coding. Unlisted procedure codes are used only when a more specific Category 1 code or Category 3 code is not found. Now, remember that we said that the Category 3 codes are those codes towards the back of the CPT book that end with the letter T, like a train, T. And those are temporary codes. Written report has to accompany the submission whenever you're sending in a code that is an unlisted procedure. And each unlisted code service is paid on a case-by-case basis. So a separate procedure follows a code description. It's going to be incidental to the more major related procedure, like breast biopsy. Before radical mastectomy, same operative session would not be coded, as only one procedure performed would be coded. So the patient is in the operating room for a breast biopsy. The doctor is going to have a frozen section done, and if it comes back that it's malignant, then he's going to want to just go ahead and do the mastectomy right then and there. He's not going to send the patient home and then have the patient come back again to do the mastectomy. So what this is telling us is that when there's a biopsy done with a distinctive procedure or definitive procedure, you're not going to code the biopsy. Only the mastectomy in this case. A separate procedure is reported when that's the only procedure performed. With another procedure or on a different site or unrelated to a major procedure. Minor procedures are often on a service-by-service basis and do not have bundle of services. a third-party payer would decide what is in the bundle. Minor procedures for Medicare has a 0 to 10-day global period, and as I talked to you before about this, major procedures have 90 days. Third-party payers decide what is in a surgical bundle. Medicare has a listing of the correct coding initiative edits, and they specify what is in the bundle. So whenever you have a moment, you could go into the Medicare.gov website and look for correct coding initiative and just pull up any kind of code, and you can see what is bundled into that code. So whatever is included, bundle means included. Whatever is included in that code, you will not bill it separately because that's called unbundling. Major guideline for surgical packages. Our procedures usually include preoperative, intraoperative, and postoperative. Minor complications. Major guideline surgical procedures, one bundle, one price. Minor procedure may have no bundle. It varies. Minor guideline example, most payers specify 90 days after major surgery. Services related to the service are in the package. They include pre-op, intra-op, and post-op. Separate reporting is called unbundling. And what we never have in a bundle is the anesthesia services. That you have to always code separately, as that is the anesthesiologist service. Surgical packages for a minor procedure include the pre and post-op, and they are sometimes reported separately. Same day may be included in performance of the procedure. Can be reported separately if specified by the payer. A minor surgery example, needle biopsy in the office, report the procedure, the biopsy. The supply surgical tray includes needles, suture materials, wipes, and drugs. You would report the surgical tray with either 99070, the CPT medicine section. Medicare bundles the surgical tray into the procedure code, so you would not bill separately for Medicare for a surgical tray. A4550 is the HCPCS code for a surgical tray, and again, it's not reported separately to Medicare. Surgery, outpatient coders, the physician payment is what we call professional. Inpatient coders, hospital payment is for the facility. So, big difference. Inpatient coders bill for the facility, for the hospital, not for the doctor. General subsection, the fine needle aspiration biopsy with or without imaging, and you will see with and without, with or without, like this, marked like this right over here. Pathology, for example, codes are for aspirate evaluation. So whatever is withdrawn in that fine needle biopsy will get analyzed by a pathologist. And that's the conclusion of our chapter 13. Hope you have a great afternoon.